like to welcome everybody to this afternoon's program on the Daisy Awards. And for those of you who don't know, we already had a brief get-together where the overall Daisy Award winner was presented her trophy and all the other little things that went with the Daisy Award. And we actually already had some cinnamon buns and everything, so that went with that. And that award winner, can I go ahead and say that now?
You can say it.
Kara Smith, and please stand, Kara. Yeah, it was really exciting today to present Kara that award because this is one of those things that I don't think that we do enough is recognize our nurses or all of our people in the hospital, and it was great to have the ability today to do that.
It is such a privilege for me. This is my first opportunity to really have such a celebration here, and I'm very excited. It is all, like I said, I've been in leadership for 30 years, and it's always hard to think of something that you can give the nursing staff that is meaningful with a budget that's not. And so sometimes you do little things, sometimes you do big things. But this year I sent a message out to the nurses and said, what would you like? And you'd be amazed at how many people wanted nothing except a Caribbean cruise. And that's what, I'm serious, it's a heart attack, that's what they said. And then they said, but if that doesn't work out, maybe, nurses are utilitarians, maybe a nice pen, a good pen light, some food, and instead of putting a lot of money in trinkets and toys, do something good for the community. And that, of course, made me cry, because I do that. So we have the good pleasure of inviting our good friend from the Community Care Clinic. We're giving $1,500 out of our recognition budget to the Community Care Clinic. And if you'll just take 3 or 4 minutes and say what the mission of that clinic is for those people that aren't sure.
Well, I appreciate the opportunity to come in and accept the check on behalf of the clinic and behalf of one of your own, Sally Talent. Sally worked as a nurse at Angel for over 30 years. And she is now the clinic administrator for the free clinic, which is the Community Care Clinic of Franklin. Many of you know that services for people that were uninsured and had low incomes really wasn't existent except for maybe your emergency room here at the hospital. And as we all know, that's not the place for them to go when they have chronic diseases or minor episodic problems, but they had no place else to turn. So about 2 years ago now, actually it was the last Wednesday of February of 2010, we opened up a free clinic which is housed at the health department. Many people thought it was needed, but we didn't really know how much it was needed until we started to see the people showing up at the door. In the first year, we kind of got our feet on the ground. We started out being open 1 night a week. We quickly expanded to 2 nights a week. Last year, 2011, we took care of 859 different people for a total of a little over 1,800 visits. We're staffed, we're a volunteer-driven organization. We're staffed by volunteer doctors, volunteer nurses, nurses, volunteer nurses. We have people that volunteer at the front desk to help the patients get into the system. We have an opportunity for anybody that would like to volunteer, and it's a great, worthwhile thing to spend your spare minutes on. You'll come away feeling better than you've ever felt. It's the best job I've ever had. I've been in healthcare for 38 years as an administrator in some capacity, and I tell people this is the best job I've ever had, because every morning when I wake up, I want to go to work. And I know Sally feels the same way, that this is something we can really make a difference in the community. So we appreciate the opportunity to come and obviously to receive the check to help the clinic continue to move forward and expand.
Thank you.
Thank you.
The next part of our program is the recognition of the CNA Award. It's something new we did this year. We sent out a notice to all of the nursing staff and said, and actually it may have been to everybody, because I got some things from non-nurses and non-nursing care folks, to say, tell us about a CNA and an LPN that is just extraordinary. Not somebody who does their job well, because that's what we expect of everybody, but somebody that's above what you would think the normal group is. And it is no surprise anymore, because we have family here and we are delighted you folks were able to come. But I'd like to ask Kathy to come, Kathy Morris, and introduce us to the person who has been awarded the CNA for this year, 2012.
Sandra is an exceptional coworker, all-out great friend, not only to me, but to all the staff. She is a fabulous CNA. The patients and family members love her, and she cares dearly about her patients. And she makes sure that she does all she needs to do for them and anything extra that they wish to have. She is always coming in on her day off to help out. She is an all-in great person and a wonderful asset to AMC. This has not been an easy year for Sandra, and yet she comes to work every day with a cheerful attitude and ready to get it done. She makes the day go easier because she doesn't let anyone let her get her down. So, Sandra Shepard.
And I get the outstanding pleasure of telling you about someone who was recognized as the most outstanding LPN at AMC. I've only been here for a short while, and I'm the director of the Med-Surg unit, and Sandra's one of my staff members, and she's just absolutely wonderful. Anything that they said is just true and more. But anyway, her intuition when it comes to patient care is legendary. She has always been able to identify patient problems and ask for help before the health or situation gets bad. I can always go to her, and she has some knowledge and experience on the situation at hand and always stops what she is doing to help out. She makes herself available to the CNAs at all times and is one of the most empathetic and compassionate nurses I have ever worked with. Her bedside manner is impeccable. Passionate about nursing, passionate about providing the best possible care for her patients and reaches out, willing to help everyone else in their work. Sounds like a perfect nurse, doesn't it? And yes, it is. The most outstanding LPN for AMC for 2012 is my pleasure to announce Kathy Talent. I'll know that last. Maybe they'll forgive me. Well deserved. The Daisy Foundation was established in 2000 by family members of Patrick Barnes, a young man who died at the age of 33 of an immune system disorder affecting the platelets. The family was grief-stricken after the sudden diagnosis and death of Patrick. They wanted to turn their grief into something positive. They were impressed and overwhelmed by the clinical skills, compassion, and kindness of Patrick's nurses. They came to believe that nurses are the unsung heroes of our society who deserve far more recognition and honor than they receive. And they came up with the Daisy Award. It's an acronym for Diseases Attacking the Immune System.
All right, so I'm going to read a couple of nominations here for Kara. So the first one actually came from Amber right here. All of our nurses are outstanding, but I felt it important to give Kara special recognition. Kara is exceptional in that she is always professional. By professional, I mean that she is immediately ready to serve the needs of the patient and their family, the doctor, and the other staff members, be they clinical or non-clinical. She does her job first and foremost, not begrudgingly, but as an act of respect and pride for herself, the hospital, and the families. She puts her job duties first and foremost, always. While this description of her may sound a bit military, I can tell you this about her as well. She is every bit a warm, welcoming, kind, and courteous individual. She is the real deal. She is pleasant regardless of what is going on in her personal or professional environment, and shares a warm smile and a laugh with everyone who walks by her. Her pleasantness is infectious, and it always feels sunnier when she is working. Her worst down day is still a great day for the rest of us to be around her. She is always graceful and poised and brings nothing less than stellar behavior and a team attitude to the department. To Kara, there is no special patient or coworker. They are all special to her. And she has a way of making sure that they all feel that while under her care or while working with her for the day, she is a true asset to Angel Medical Center as a nurse and just as the person she chooses to be at work. And I can just say, having worked with Kara now for about the past 17, I guess longer now, we worked together before some too, These are the nominations we got, but we get those kind of comments all the time, even before we have the Davy. So I just wanted to thank Kara for being the nurse that she is.
Patrick, whenever he was sick and in the hospital, the family, about the only thing he wanted to eat was a Cinnabon. You know, in the mall, the ones that kill you when you walk, yeah, that's them. So whenever he would send his family out for his Cinnabons, he would ask them to bring enough for the nurses just to say thank you. So that became their trademark. These were made by our kitchen, and they are incredible. But the decorations and the way they potted them, I think, are magic. So please, before you leave, grab some, eat some, enjoy them, and every time you smell cinnamon, think about how somebody in healthcare, as a nurse or otherwise, has made a difference in your life. Mark Barnes, who is the father of Patrick, who died, said in the first, when he did this, "We ask each of you nurses to just pause for a minute and realize that thanks to your education and training, your commitment and judgment, your compassion and connection with your patients, you are very special. You make the world such a better place by just doing your job." And the reason they said that was every time that they would talk to somebody about thank you so much, they'd say, "It's just my job." And that's what real nurses, real caregivers are. They're the people that don't just do what the book tells you to do in the course of an opportunity. Their heart reaches out and touches that patient and that family and tries to soothe whatever pain is going on at that time. So, I would remind every one of you, remember that while nursing is a career and a skill, it's also a love affair with people that need you and who are hoping that in spite of their crankiness and their weird requests and their irritability and their funny smells and all the other things, that you'll look past that and just see somebody that needs your touch.